Good afternoon, everybody. Today we are going to be talking about Pes Planus and Plantar Fasciitis and try to answer any questions that I can. Before we get started, I just wanted to kind of go over sort of a summary of the two conditions. And I thought I'd start with the Pes Planus. That's a fancy way of saying flat feet. And there are sort of two different classifications of Pes Planus. One is the rigid type and the other is the flexible type. But it basically discusses the arch along the bottom of the foot, the longitudinal arch. It's classically oriented or discussed in a sort of radiological fashion, but the clinical evaluation can be used to diagnose the condition. So with rigid flat feet, you have the joints of the foot that prevent or have severely decreased motion. In addition to the arch that does not improve or I guess exacerbate when you flex the toes. So it's got that rigid flex or lack of flex to that Pes Planus. The flex or the flexible flat feet, the flexible Pes Planus, is more associated with ligamentous laxity. So the ligaments in the foot are too weak and too loose, and you end up with this weak foot. The muscles of the foot are just not supportive, and you can have three different types actually of the flexible Pes Planus: type 1, type 2, and type 3. Type 1 is the most common. It's also mostly found in children. Usually not painful. And the treatment is simply arch support in the foot. Type 2 is more of a hypermobile flat foot, and that's one that is associated with severe ligamentous laxity. So you have the ligaments in the foot that are just not supportive. Those who have that ligamentous laxity, the treatment is directed at more of a support, and specifically it's supporting the Achilles tendon. You can get some benefit from stretching exercises, which I would encourage you to go through, physical therapy if that was something you needed. Then type 3 Pes Planus is associated with one of the posterior tibialis tendons. So the tendon that runs down the side of the lower leg into the foot. And it is also usually associated with individuals under the age of 20. And this does tend to present painfully. And so the type 3 flexible flat feet do tend to have a pain, sometimes even a swelling at that the lateral side and the lateral and lower side of the foot. So that's sort of a rough, gross discussion of flat feet, the rigid type, the flexible type. Typically, with the exception of that type 3, it is not painful, and typically it is very well supported with arch supports in the foot. But it does not require imaging. When I just say it's discussed in terms of radiographic, that's just based on how the films will show. But clinical exams can diagnose this condition. Now, plantar fasciitis is probably the more common topic that we wanted to talk about between the two. So plantar fascia is the plantar aponeurosis, the fibrinous tissue at the base of the foot. It attaches longitudinally just underneath the skin, and when inflamed, it becomes that itis, that fasciitis. The pain tends to be worse in the morning and worse with walking, and it is one of the most common foot problems and heel pain in adults. Estimated to be affecting about 1 million patient visits per year. And the peak incidence occurs between the ages of 40 and 60 in the general population, that being younger in runners. So a lot of our veterans, y'all are runners. And so a lot of you will potentially have this manifest earlier than, say, the 40 years of age mark. It is usually unilateral. However, in about a third of the cases, it can affect both feet. Patients typically describe a heel pain that's worse during the first steps of the morning or after some sort of period of inactivity. And the pain does typically tend to lessen as you increase your activity towards the end of the day. But I wouldn't say it goes away. I would just say it lessens. Laboratory tests are not helpful. Radiographic and imaging studies are not necessary for the diagnosis of plantar fasciitis. Causes. For the most part, the etiology is poorly understood. Risk factors do include obesity, prolonged standing, jumping, flat feet, or the Pes Planus that we talked about increases your risk, as well as running that we talked about. And I think I mentioned this, but obesity does increase the risk as well. There's a high incidence in runners. I know we talked about that. And that sort of micro trauma that presents over and over increases the risk for developing a plantar fasciitis. So, to my veteran community who spent years training hard, running, not always necessarily in the best shoes, and if any of you have flat feet, those are risk factors that will increase the likelihood that you might suffer from a bout of plantar fasciitis. The diagnosis, and this is probably one of the most important things, of plantar fasciitis is based on history of inferior heel pain, worse in the morning when starting to walk, and point tenderness at the base of the heel. And so, like if you press on the bottom of your heel, you'll have that pain and you'll have that tenderness that exists. The initial treatment options for plantar fasciitis are largely aimed at the symptoms. So pain control, making sure you have good arch support, the right running shoes. If you need to lose weight, making sure that you do that as well. And then, of course, stretches. The stretches can be simple as, and you're trying to stretch the calf muscle and the Achilles tendon, or they can be a little bit more complex, requiring physical therapy and stuff, specific exercises for the foot. But most of these stretches can be done at home. Again, try to avoid wearing flat shoes and make sure you have good support when you are walking or running or engaging in physical activity. That will certainly help. Non-steroidal NSAIDs, the non-steroidal anti-inflammatory medicines, are also very beneficial on a short-term basis, but I would definitely consult with your physician about any use longer than 2 weeks, because they have adverse effects as well that you want to make sure that you're addressing that. But it can certainly be beneficial to some people. But consult with your primary physician about that before you start any medications. The most successful therapies were things like weight loss, stretches, and appropriate heel support. Although these modalities are not validated yet in the literature, they anecdotally have shown some benefit to have where people who wear night splints have specific immobilization periods, and then even extracorporeal shockwave therapy, which is sort of a use of an ultrasound to loosen up the tissue in the bottom of the foot. Again, not proven yet, but it is out there, and there are some people who are showing benefit from that. The other thing I wanted to mention, surgery is also not proven. I'm not a surgeon, but I would be very cautious about any surgical intervention. Certainly make sure that it's somewhat of a last resort, because at this time, there's not literature supporting that is a good option. It may be the last option, in which case somebody may benefit from it. But at this point, I would not recommend that. Certainly talk to your orthopedic surgeon, your foot surgeon. But at this point, it is not a proven recommendation. So I would just be aware of that in regards to surgery. On a positive note, the outcome for most people with plantar fasciitis is favorable. About 80% of the patients who have plantar fasciitis see resolution within a year of treatment. And again, whether it's a non-steroidal, an Advil, or arch supports, weight loss, stretches to improve flexibility, these individuals have favorable improvement in 80% of the time within a year. So that's good. I know that many of you have spent the bulk of your careers under rigorous training exercises. Kind of maybe that micro trauma is a little bit more macro in some cases, just because of the repeated running and exercises in the boots that you've worn. But please know there are treatment options out there. Do not feel obligated to get labs or images, because a good clinical exam can diagnose plantar fasciitis. So that is, I know, an overwhelming summary for both Pes Planus and plantar fasciitis, and hopefully it gave you some insight into kind of the disease presentation, how we look at it in terms of diagnosis, treatment options, and then prognosis, which thankfully is pretty good for most people. I'm going to stop here as I've been babbling on and see if we have any questions or if I can help answer anything for anybody. So the documents you would need to get a diagnosis is simply an interview. You would need to set up an appointment with a physician, and we can do it on the telemedicine platform, so that we have a history and physical that we do, where we talk about the symptoms that you're having, how long they've been going on, and then we'll kind of walk you through the questions that we have so we can do the diagnosis. But I would say you don't really need any documents for the diagnosis piece. I'm sure you would need documents for the Nexus letter team, and I'm going to defer that to them. But from a diagnosis standpoint, you just need to show up, and we'll have the questions that we have, and we'll make sure that we run through the questions, make sure that you meet the criteria for diagnosis, and then we can kind of go from there. Yes, the question is, can the conditions be secondary to other service-related conditions? And yes, there are some injuries that could have been sustained that could make it a secondary chronic situation, where you have sort of a chronic inflammation of that fascia at the base of the tissue, or at the base of the foot, depending on other injuries that may have been sustained. So yes, it can be secondary. It can also be primary. I think the answer to that question is yes. I would want to defer again to the Nexus letter team, who works more closely with service connection as opposed to me on the diagnosis side. But given that you had flat feet going into it, and knowing what little I do know about, the rigors of training as a Marine in terms of the running and the physical activity, yeah, I think that aggravation could certainly have worsened. But I would want to more formally defer to the Nexus letter team, because they do the deep dive into helping make sure that your service connected. But as far as from a clinical diagnosis standpoint, I have seen patients who have had aggravations of both Pes Planus as well as plantar fasciitis, in largely in terms of the pain from rigorous physical activity. Yes. Both of these diagnoses can be performed by telemedicine history and physical examination. We can do this on the telemedicine platform. So typically, bunions in and of themselves would not lead to flat feet, because bunions would be more external tissue, and the flat feet would be more of a joint and ligament issue underneath that. So the bunions would not be connected to flat feet. I don't know the answer to this question, because I know as a physician, I differentiate the diagnosis between Pes Planus and plantar fasciitis, but the VA, I don't know how they handle this in terms of, do they connect you? Does one connect you for both? Because they are two separate conditions medically. So I would think from a medical standpoint that you would be able to get service connected for both. again, that would be a better question for my Nexus letter colleagues. I know from a medical standpoint, these are two separate conditions, so you should be able to get connected for both, just from that standpoint. Unfortunately, the VA may not see it that way, but that's medically, these are two separate conditions that you should be able to approach the VA for. So I have seen patients with forefoot pain that develop plantar fasciitis because it affects their gait. So the answer to this question is yes. If you have pain in the anterior or the forefront of your foot that is affecting your gait, it can exacerbate pain in the other parts of your foot. And if it alters your gait, you can develop a plantar fasciitis. I have seen that. It is somewhat rare, but it is not unheard of. And it has everything to do with the changes in the gait that patients have when they have severe pain in the forefront of their foot that drives them to use more impact on the heel, and their gait is changed because of the pain. So yes, I have seen that. It is rare, but I have seen that. So the best way to get started with Telemedica is we're going to plug you into the website right now and the phone number, and you can email customer service at telemedicallc.com, or you can dial the phone number at the bottom and they'll help you get set up with both Nexus letter team as well as the medical diagnostic team if you need an appointment. Certainly, if you have the diagnosis of either of these, we can hook you up with our Nexus letter team and work on your Nexus letter to try to help get you service connected. But if you're just curious, hey, look, do I have, I mean, I think I do. I've been a lot of pain in the heel and really hurts in the morning when I walk. That's kind of a great place to start when you want to call in, say, hey, listen, I'd like to talk to one of the medical providers for a diagnosis. I think I have plantar fasciitis, and here's why I think that. And we can go through those questions. But again, that pain in the heel that's worse in the morning or most severe with initial activity, that's pretty classic for plantar fasciitis. And I usually tell people it's not subtle. You'll know. So I don't know of other documents that would be beneficial. I'm sure that the Nexus letter team will help you put that together if there are additional documents. I would say that from my standpoint, the most important document that you're going to need is a diagnosis. And I know it sounds oversimplified, but if you don't have the diagnosis of plantar fasciitis, you can't really move forward with anything with the Nexus letter team. So I'm sure the Nexus letter team knows of other documents that may be beneficial in terms of increasing your chances of getting the claim. But from my standpoint, I just want you to start with making sure that you've got the diagnosis. And that way we can go forward and you can say, hey, look, I've been seen by a medical physician. I've been seen by a licensed independent medical provider, and they have confirmed that I do have plantar fasciitis. And then you can proceed forward appropriately with any other documents that might be supportive of that claim. So the question here has to do with secondary service connection for things like hips, knees, shins, ankles, secondary to plantar fasciitis. And I have not seen that affect other joints. That having been said, I don't know that it's impossible. I just haven't seen it affect the other joints because it's pretty isolated to the heel and the base of the foot. But that having been said, again, I think any of those service connection aspects are better questions for the Nexus letter team, since that's their line of work, because it is possible that there's data out there that I'm just unaware of. Well, I want to thank everyone for logging on and listening to me. Hopefully it was helpful, engaging a little bit about plantar fasciitis and Pes Planus. Certainly don't hesitate to reach out if you have other questions that you think of later or forgot to ask. But hopefully this is helpful. We'll try to post some of this information on our website so you can refer back to it. And please don't hesitate to reach out if you think, hey, look, I'm having some heel pain. I think it's plantar fasciitis. And if we need to get you plugged in to our Nexus Letter team, we can also help you do that. So again, thank you to everyone who signed on. I really appreciate it. And I hope you all have a great day.